Hi, my name's Ava. I had 2 unsuccessful surgeries in the past with 2 doctors that left me with pain and no feeling on the top of my wrist for 4 years. I was a former basketball player and I noticed that I didn't have the ability to shoot or move my wrist. So I saw a plastic surgeon first who mentioned that I had a ganglion cyst. He went in to remove the cyst. Turns out that he actually was too hard and messed up with my ligaments. Following that, I saw another doctor who was actually a wrist surgeon to fix the problem, and he actually fixed what the plastic surgeon messed up but didn't fix my actual problem of having the ganglion cyst sit on my nerve. I left it for all 4 years with pain and no feeling because I was scared to see another surgeon. Then I came across Dr. Michaeli, who took care of me very well, and I had all trust and good feeling with him. He made me feel so comfortable where I booked my surgery within that week. With all the hard work Dr. Michaeli did, I'm so happy. He accomplished everything that needed to be done. I have all of my feeling back in my hand. I have no pain. I'm able to go to the gym. I'm thankful, and he is the best doctor out there.
Ganglion cysts are a very common pathology that we see as hand surgeons. I remember when Ava came in and she was complaining of wrist pain, and she'd already been operated on by 2 other surgeons. One surgeon had made a cut vertically, the other surgeon had made a cut horizontally. Each one had their reasons, but each time the cyst came back. But after the last surgery, she also developed like a tingling pain, like an electric shock, and was interfering with her abilities to actually exercise. When I examined her, one of the first things that came to mind is that we have this nerve called the dorsal radial sensory nerve, and it gets kind of small as it creeps up over the hand. My first thought was that she must have some sort of a superficial neuroma of either a branch of the dorsal radial or the dorsal ulnar, as they both contribute to the top of the hand. I made an incision down through the scar, and I found a nerve end on each side of the scar, and then the nerve heavily tethered into the scar. And it wasn't able to be removed from the scar itself because it was so small. So I resected that segment of nerve and I replaced that with a cadaver nerve that we call a nerve allograft. Additionally, I also found a reoccurrence of the cyst a lot deeper into the joint. So I dissected all the way down to the stalk, because we know that that's very important, and I cauterized the section of the ligament that it was coming out of, from the scapholunate ligament, and closed everything up. And then in order to further bolster this and make sure that it wasn't coming back, so this is a 3rd surgery for a wrist. This is a young lady who's active. I fat grafted, and I did a technique that we call nano-fat in order to really bring out the stem cells from the fat. And I wrapped the nerve with a porcine nerve wrap, closed the skin, and today she's doing fantastic. She's able to go back in the gym. She's able to do her push-ups, her CrossFit, and she's doing great. So I really think you have to give every surgery the respect it deserves. But this possibly could have been avoided by looking for the nerve during the initial surgery and making sure to move it to the side. And if it was going to absolutely be in the surgical field, because they can be very close to the skin, we could have protected the nerve with a nerve wrap from day one, and maybe we could have avoided this scenario.